All right, so I added a little bit of heavy body where I did my trimming, and then I'm adding light body over the top of everything else. Had I put a lot of heavy body, I would have gotten a lot more tissue displacement. Keep everything nice and relaxed. There we go. Tissue displacement is not good during your impressions. Okay, go ahead and blow through your nose. Good. And one more time, blow through your nose. Good. And then open. Thank you for that. Don't worry, we're not going to put this on YouTube. America's Funniest Videos. Okay, keep everything nice and relaxed. Good. And then open as big as you can. Good. And then purse your lips again. Good. Back, and then purse your lips one more time. Good. Okay. So I just did the 4 things I normally go through when I'm trying to get an upper impression. Again, open wide as you can for the coronoid process. 2, the Valsalva maneuver for the vibrating line. Number 3, pulling the buccinator and the masseter down and forward, and then having the patient purse in the anterior. You can pull in the anterior also. I find that actually creates a very thin impression, and the lab's more likely to create a thin denture flange in that area. So you want to balance how much you're having the patient purse and how much you're pulling down in that area until you're happy. If you ever seen a really good impression, it typically looks pretty thick and rolled in that area and not super thin. Some patients have very, very tight orbicularis oris muscles, you know, the perioral muscles. Those patients definitely need to have thin denture bases in those areas, sometimes flangelless. So you really want to get a sense of who your patient is and what their muscles are likely to do to your denture as you're creating the impression. So it looks like we're almost done here. And as you can see, by adding some thickness in this area here, I've actually increased how much the wax rim shows. That's what I was talking about earlier, where you can actually control where the wax rim is by thickening the flange, because the thickening of the flange displaces the lip in incisal-gingival dimension. So you always have to keep that in mind. If I was ignoring that and I was happy where my wax rim was, and then I sent this to the lab, it's very possible that they would pour this up and then have a denture base that's too thick and too long. So you really have to think about this stuff. All right, so everything looks good. There's my final impression. You can see the hamular notch coming around. There's the midline. So the lab should have very clear information on where to place the posterior palatal seal. Patient has an extraction site here. I'll have the lab account for that, and I'll reline that in the patient's mouth during delivery. You can see here the frenums were captured, frenulum were captured, anterior captured, and a really nice rolling all the way around. The best part is I don't have any tray show through. Now look how thick that anterior section is. That's too thick. So what I'm going to do is take a number 12 and basically just thin that area, and then I'll put it in the patient's mouth and confirm the thickness so that I can tell the lab, here's how thick I want that flange to be. I'm also getting rid of all of the occlusal overflow of the PVS material. I can use this just like wax, you know, make some marks there, some grooves, indentations. And And just so you can see the pallet right here. If it doesn't show through in the video, then you can take our word for it. Light body does a very good job of picking up that area. So I'm just trimming away excess here to make it as thin as possible. Too much information is always an opportunity for the lab to send you back something that you didn't want. All right, so I'm happy with that. I'm going to trim this a little more. And then I'm going to try it back in and make sure that her lip is at the proper dimension incisogingivally. All right, Ann, go ahead and open nice and relaxed for me. You've been a wonderful participant today. Thank you very much for allowing us to explore better denture prosthodontics through thought and education. All right, so go ahead and close down a little bit, let your lip relax. So she's showing a little bit too much there. With that said, I'm happy with that. I can push the teeth in the wax setup. I always want to have them a little longer so I can push them. Good idea to tell the lab to shorten the necks of the teeth to give you room to push up. Nothing's more frustrating than pushing denture teeth into the wax rim, then you got to take it out, remove all of the wax on the neck of the tooth, trim it back, then you got wax stuck in your burr. We've all been there and it's no fun. The last thing I want to do, we have the fox. So I'll need the fox plane.